Hi, I'm Pam McDonald, and welcome to the Perfect Gene Diet. The Perfect Gene Diet is an integrative medicine approach to preventing or reversing disease utilizing your own unique genetic blueprint. I'm a nurse practitioner, and I started my nursing in England, and I came to the United States in 1981 and became a women's health nurse practitioner, worked in primary care, and then went into integrative medicine. I wrote the Perfect Gene Diet book because I was working in primary care and I was treating patients with mainly medication, and I was finding that this was not getting people better. I had one particular patient who had a very strong family history of heart disease, and he was very mindful with his exercise and his diet, and he was eating a low-fat diet. He got a heart scan and it showed that he had a positive heart disease. This was really interesting to me because his total cholesterol was extremely low. And so what I did is I went out and I researched what heart disease was and what the genetic component of heart disease was, and found that there were actually 13 different types of cholesterol, as well as utilizing the APOE gene. And it was this APOE gene discovery for me as a primary care provider that really changed how I cared for patients, how I treated them. And I started to treat them with diet because the science and the research really showed that an individual APOE gene really needed a different diet. So if you had a 2, you had a different diet. You had a very high-fat diet versus if you had an APOE 3 or 4. An APOE 4, you need a low-fat diet. We have disease at epidemic proportions now, and some of the cruelest diseases that we really have not experienced at epidemic proportions is happening now. And I think this is a true solution for millions of people to be able to take this knowledge and either prevent or reverse disease. And that has never happened before. And I think this is what this Perfect Gene Diet is going to bring to the public. I think it's really important that this message get out because the technology is there, and we have that ability to go in and look below the tip of the iceberg. We can look at this new science and this new technology, and we can really understand what causes disease at a cellular level and how we can turn it off. That information is there. It's ready to be embraced, and we need to just get it out and tell people about it. And I think doing the APOE gene and testing an advanced lipid panel will bring such great knowledge to an individual to stop, reverse, or prevent a disease.